Hi everyone! In this video, I'm going to talk to you about this tool, which is known as the pelvic wand, and this is popular in pelvic rehabilitation. So this tool was designed to reach both the shallow and deep muscles of the pelvic floor. And what it does is releases the trigger points, tender points, and overall tension in those pelvic floor muscles, which can develop from having chronically tight or tense pelvic floor muscles. Now, tension and trigger points in the pelvic floor can manifest as painful urination, painful bowel movements, pain with intercourse, constipation, difficulty emptying your bladder, and pelvic pain in all genders. So this can be a great tool when inserted and used correctly in managing those pain symptoms, those bladder symptoms, and the bowel symptoms. So one end is thicker and comes to a point. This one was designed to reach the deeper pelvic floor muscles vaginally. And our other side is thinner and has a rounded end. This end was designed to reach the shallower muscles vaginally or rectally. Now you can use this side vaginally if for any reason you do not want to use the thicker side that comes to a point. When you're using this tool, you're only ever inserting about 1 to 2 inches on either side. Don't let the shape or the length intimidate you. You are not inserting too much of this. This design was to help you hold it and angle it without straining yourself. Stay tuned for the guided meditation where I'll go over setup and instructions for use. I wish you the best with your pelvic health journey. The following meditation uses language and instructions for using the pelvic wand vaginally. The same instructions apply for using the wand rectally. If you are using the wand rectally, you can disregard the clock analogy used to describe directions within the vaginal canal. Before we begin, make sure your wand is clean. Intimate Rose, which is the manufacturer of this wand in particular, recommends washing with warm water and soap. Also, make sure you use a water-based lubricant, which you will place on yourself as well as the first 1 to 2 inches of the side of the tool you are using. Using a lubricant will prevent any discomfort and protects the silicone coating of the wand. Find a place in your home for your practice that is safe, quiet, and comfortable. This could be your bed or couch, as long as you won't be disturbed by other members of your home or pets. Decide which end you want to use. As a reminder, the pointed, thicker end is great for the deeper pelvic floor muscles, while the shorter rounded end, which is thinner, is best for the muscles near the entrance of the vagina and the rectum to address tender points there. Start by lying on your back with your knees bent and feet planted on the surface. You can use pillows to position yourself in a slightly reclined position to enable you to best reach without straining. You could also lie on your side. If you choose to do so, make sure to bend your knees and support your top leg with a folded pillow between your knees. Before we introduce the wand, let's take a few deep belly breaths to passively lengthen our pelvic floor muscles. Slowly inhale through your nose. Notice the sensation of your stomach expanding as you inhale. See if you can suspend or pause your breath for a few seconds at the top of your inhale. Now, slowly exhale as your stomach deflates, moving back towards your spine. Let's do 3 more breaths like this on your own. Gently bring the wand to the opening of the vagina and carefully insert it about 1 inch in.
Do not force this insertion if you feel any pain. If you're comfortable, you can insert a bit more, potentially up to 2 inches. Gently sweep the end of the wand until you encounter a tender point. Picture the vagina as a clock, with the clitoris being at 12 o'clock and the very base of the opening of your vagina being 6 o'clock. When angling the wand, avoid pressing straight down at 6, which is towards the rectum, or straight up at 12, which would be at the urethra. Avoid these places since they may cause urinary or fecal urgency or possibly discomfort. The numbers of the clock between 12 and 6 are all appropriate to angle the tool in and find tender points. When you do find a tender spot, gently press and hold the end of the wand there. This pressure you're using should be similar to how you would press on a piece of fruit without bruising it. Maintain gentle pressure on the tender point, and let's do a few deep belly breaths. The goal is to breathe deeply until you feel some of the tenderness subside, and at that point, then you could move on to another spot. This may take 1 to 2 minutes to allow the tender point to fully release. Take a slow, deep breath in through your nose. Suspend that breath at the top of your inhale. Then slowly exhale out through your nose. And visualize those muscles softening around the tool. Again, slowly inhale, focusing on the rise of your stomach as it fills with air. Slowly exhale fully, noticing how your stomach deflates. Inhale, filling your stomach with air, pausing at the top of your breath to appreciate the fullness of your stomach and your lungs. And exhale slowly, bringing your stomach back towards your body. If you feel ready to move on, go ahead and sweep the end of the wand to find another tender point. Once you identify a spot, continue to breathe deeply into your stomach and your pelvic floor. On your inhale, visualize your pelvic floor muscles softening and releasing any tension they might be holding. Exhale slowly. Visualize the tender spot you are on. Imagine it slowly shrinking and dissolving away as you breathe deeply. If you feel ready to move on to the next spot, go ahead and do so. If not, you should stay here where you are and continue breathing. You are safe here in this moment. You are safe with the pelvic wand inserted, and you will continue to be safe and well after your practice. On your next exhale, scan your calves, your thighs, your glutes, and your abdominal muscles for any tension. If you find you are tensing up in a certain area, give yourself permission to let that go. Focus on softening those muscles. When you relax your whole body, your pelvic floor can best relax too. If you're ready, you can move the wand to the other side of the vaginal wall or clock, according to our analogy. If you have already moved the wand to the other side, then you can sweep to find another tender point. At this point, you may continue on with your practice. If you need to end here, make sure to thank yourself for taking the time out of your day to take care of your body and your mind.